Hi, I'm Juliet and I'm an occupational therapist based on the oncology therapy team. I'm here today to give you a bit of advice on fatigue if you've got a cancer diagnosis. Now, fatigue is different to ordinary tiredness, and I think a lot of people go into treatments thinking, I know how to deal with tiredness, I've been tired before, I get an extra night's sleep. The difference with fatigue is it's hard, ingrained, and no amount of sleep will take it away. And it's really, really common when you're suffering cancer or when you're having treatments for cancer. So it's that sort of tiredness where you feel like you're already tired tomorrow and you know nothing you'll do will take that away. So what is fatigue? It is what I've just said. Patients have described it as if I dropped 20 pounds, I'd just let it go. I wouldn't feel like I need to get up and grab it. Or it feels like an overwhelming need to just lie down to sleep, and it's such an extreme tiredness, it's like nothing you've experienced before. So this all sounds quite awful, but what we're here today to talk to you about is how we can help you overcome that fatigue. So it can happen for many reasons, and there's lots of theories around why we get fatigued. It may be to do with the cancer itself. It may be to do with the treatments you have or a side effect from the treatments. The one thing we know is it's unseen, so people around you can't see it. They can see other things from treatment like hair loss, or if you're being sick, they can't see extreme tiredness. So it's really hard to communicate to people. And the other thing is there's no medication that can take it away. So we know if we've got nausea, there's often a medical route that we can take. With fatigue, there isn't. So we have to find a way to help you manage this with non-medical routes. It's quite an extreme response to what's going on with our body, and in a little while I'll go through why that might be. We also know other things happen when we have a cancer diagnosis that can cause fatigue, and that can be worries around that diagnosis, and that's normal and natural. Your psychological state will be all over the place. You'll be often sidetracked with thinking about that a lot of the time. That can affect your sleep and how you are. The side effects of treatment can be awful. You can need to go to the toilet more, or you can have dry mouth. So many things that will affect how much rest you can get that help your body recuperate. Also, side effects of drugs, problems with eating, if you're nauseous or you've got soreness for any reason. And pain as well, which we know in itself from our pain experiences through our life takes it out of you. And lifestyle, quite often when you have a cancer diagnosis, people still have elements of their life that they have to continue through harsh and rigorous treatment. So sometimes just trying to be you and manage your life becomes really difficult. So why do we get fatigue? There's lots of theories of why. We know some of the reasons, but it seems to be that when our body is injured in some way, it goes into a rest state. So when we get a cold that we've all experienced, your body feels a bit tired, you have a bit more sleep. That helps your body recover. And it seems to be that with fatigue, it's common. A lot of our research comes from longer term conditions such as MS or chronic fatigue syndrome. It seems to be that our body has an insult to it and it sends it into a rest mode because that's how our body knows how to respond and how to heal. However, we get into this problem where we're stuck in rest mode and our body can't get out because our body's taking a lot longer to recover, or some of these problems can persist. So the greatest analogy I can come up with is when I'm on holiday, and I tend to take the sort of holiday where I will lie on a beach and I'll spend all day lying on a beach doing pretty much nothing. And I get to the end of the day and I think, I'm really exhausted and I've got to find the energy somehow to have a shower and go out for dinner. And I know that normally in my day-to-day life, I can get up, I can get myself to work, I can do a whole day's work and get home, and I don't feel that sort of level of fatigue that I get when I've been doing nothing all day on holiday. And what's happened is my body's entered into a rest mode and it's got stuck in that rest mode and it's struggling to come out of it. So we think what happens with fatigue is our body gets stuck in a rest mode, and with all these things that are going on, it struggles to come back out of that rest mode. So how I describe it is we've got a battery life within us. We all have a battery life, and when we're having treatments and fatigue is taking over, our battery looks more like that phone you can see that's got no battery left. Now, if I'm on the motorway and I break down and my phone looks like that, I've got no chance of getting myself out of that situation without external help. I can't ring the RAC, I can't ring the AA, I can't ring a family member to come and help me, I'm stuck. If I'm like the next bit where I've got a little bit of energy in my battery, I've got some chance. I might be able to ring someone and get some help, but my battery's going to deplete quite quickly because there's not much energy left in it. If I've got like the phone with more battery, I've probably got a good chance that I can get help, I can get phone calls back, I can communicate with the people I need to, I can inform them where I am. What I do know is if I'm stuck on that motorway for longer, I can't stretch my battery, I can't make it get bigger because of the situation I'm in, and our bodies are the same. If we wake up without much energy, we can't make that energy go further than it will. We can't stretch it any further than it is. All we can do is recharge. And the importance of fatigue management is about recharging our batteries as frequently as we can. So one of the problems with fatigue is we get stuck in a cycle. And this is the biggest problem, that if you take one thing home from this, is this bit. So we have little energy, so we'll often rest in the day. Then that can affect our sleep at night. Then the next day we won't have slept as well. We wake up with less energy. So we get into this cycle where our patterns aren't as good. Or we wake up and we've got a good day and we think, wow, I feel great today. I'm going to do all those things that I haven't been able to do for the last 4 days because I've got the energy to do it today. And then what happens is our body goes, whoa, 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 what are you doing? And that will knock you out for a lot longer than if you'd have only just done one of those jobs. So the key message of today is to try and get yourself out of that boom bust cycle. I've got loads of energy, I'll use it, I've depleted my battery, I've now got to rest until it slowly recharges. And our bodies, just like a mobile phone, if we put our mobile phone into charge when we've only used 10% of it, it'll be up to full charge a lot more quickly than if we've drained it to 5% and then we put it onto charge. It will take a lot longer to get to 100%. And it's exactly the same with our bodies. If we leave some energy in our battery, we will get more energy back from a small rest than we would if we drain it completely. So part of fatigue management is getting used to what our body's batteries are, looking at what energy we use and working out how we use it without depleting it too much. So remember your braking distance. You need to work out what energy levels you have and leave a gap so you don't use them all up. You keep a bit left. So how do we do that? We've got to think about the supply and demand. So we've got to think about what energy we can put into our batteries and what energy we need to take out. And that's different for everyone. So some people will find going to work really energy depleting. Some people find the fact that they're working and they like their job and they like their colleagues, that might put energy in because they see that as something that gives them something. Triggers will be different for everyone. And sometimes concentrating on lots of computer work can be really hard for some people, but not for others. So it's about thinking about what takes your energy away for you and what gives you energy back. So the easiest way to kind of get an idea of that is to start to think about mapping your energy levels in a diary and noting what you do. There's an example of a diary here, but essentially you could do it on anything. What I would say is you're best to monitor your levels of how you're feeling first thing in the morning, so knowing what you're starting your day with, whether you're feeling really extremely tired or whether you're feeling quite good. Then I would start to map in what you've done that day. So you had a wash, you got showered. How did you feel after that? What were your energy levels like? You went to the supermarket. How did you feel after that? Then I would start to think about putting more pleasurable activities in a different colour. And what you can see over a week or 2 weeks of doing an energy diary of, are you in that boom bust cycle where you suddenly do a load of stuff on one day and the rest of your week's quite knocked out? Are you in a cycle where you're only doing things you have to do and none of the things that you enjoy doing? Because we think that things you enjoy doing are more likely to put energy back into your battery. And what you can start to do once you've got a breakdown of your week is really look at What do I like doing? Where's my energy? Oh, that day I felt better. That's because I did something good the day before, or I did something active the day before, and that's actually given me more energy. It will just give you an idea of what you're doing with your day and how you can plan your weeks moving forward. Because what we do know from the research is that we can improve things. So you're probably thinking, I'm exhausted anyway, why on earth would I put a load of energy into writing a diary? And I would understand that. What I want you to understand is if you can understand what you need to do in a week and break down what you have to do, what you can do, what you should do, and balance it out, you're likely to achieve all those things, but in a way that leaves some energy left in your battery. So it's a bit like the hare and the tortoise. You probably don't have to do everything in a certain pattern and in the way you've always done it. You can still get it done. And I know I'm certainly the world's worst for thinking, right, before I go to work, I have to clear up, I've washed up, made the beds, done all that. By the time I get to work, so I'm often exhausted. But actually, what would happen if I didn't wash that up? It's not going to go anywhere, nothing untoward's going to happen, but I'd have a bit more energy for getting myself to work. So it's starting to think about the hare and the tortoise, and you will get there. Things will get done. They might not be done in the way you're used to doing them. So we think a lot about, with fatigue management, of prioritising and think about what things do I have to do. So when I'm looking at my diary and I'm looking at the end of every day I'm exhausted, what do I need to do in that day? What could I do differently that would make it less energy sapping, I suppose? So things like walking around a supermarket, some people that would be exhausting. You've then not got time left for the things you enjoy doing, like meeting family for a meal or socialising. Could you have your shopping delivered? Could you sit down to do your ironing rather than stand up? So it's starting to look at those diaries and thinking, what things in this week do I have to do? If I've only got this much energy in my battery, what can I eradicate? What can go? What doesn't matter? What things can I do differently to reduce the energy? And what things can I add into my weekly plan that feed into my energy levels? And we've got a few talks coming up after this one that talk about what we can do to put energy into our batteries so we can recharge them. But it might be that we have to modify our lives and strip it right back to start with after you've been through the traumas of treatment and a cancer diagnosis before you can start to build up. I will just say at this point, because it is quite important, that if you're having to work, that having a cancer diagnosis does give you certain rights with employers, and that we can look at getting help and facilitation with that. But that's a very different level, and that comes down to the Health and Safety Law Act. And what I'd say is if you're in that situation where employers are expecting a lot of you, you may need an individual session to discuss with you your work patterns. At the end of this presentation, I give you our number, and if you're in that bracket of people, please do get in touch and we'll give you an individual appointment to discuss that with you. Because work, it's all fine with the things you can control in life, and what you can cut out is a very different thing when you're at someone else's beck and call to decide what that is. So a big question everyone asks is, will this get any better? If I cut everything out of my life, so I've left some battery left, will I ever be able to do stuff again? And the short answer is no, you don't have to cut things out permanently. All the research around fatigue management shows that if we strip things back down and leave some energy left in our battery every day, the next day you'll find that battery life gets further. So all our research says is if you gradually introduce things again and gradually build up, you should be able to maintain your pre-diagnosis levels of energy. There are some caveats to that, in that if your diagnosis isn't on a curative regime, there may be some areas where you have to accept that no, that might not be the case, and you might have to keep some pacing and reducing activities permanently. If you're on a curative regime and you manage your energy levels well from the beginning, so you stop getting into that boom or bust cycle, all our research shows us at the end of treatment you'll pick up a lot more quickly. What the problem is our body goes into rest mode, sleep mode, restorative mode, and gets stuck there. If we stop that happening from day one just by leaving energy left, we can reduce the longer term effects of that and build up much more quickly. So how can I charge my battery? So what we can look at is what depletes our battery, and we talked about the triggers earlier in the presentation, but also what can we do to charge it? So how can we help our battery life? So thinking about what saps it, and some people do find socialising takes energy out or work takes energy out, but that could go to the energy in. If you get psychological benefits of those conflict. So it's different for everyone. So some people might find their triggers are travel, some people might find it's stress, some people might find it's work. That's why you're doing the diary. Look at what leaves you most exhausted. So generally when we're looking at the diaries, if you wake up exhausted, you look at the day before. If you wake up feeling better, look at the day before, what were the differences? What we do know is we can put energy in, and the bits that we know put energy in are modifying activities, so a bit like I talked about earlier, not depleting your energy levels to zero by doing them slightly differently. Do things that you enjoy and are fun, and that's different for everyone. Some people it's reading a book, other people it's meeting family members, some people it might be taking the children to school. We also know that by maintaining our nutritional levels, which can be really hard in treatment, we can give some energy back to our bodies, and there's a talk about that a bit later. We also know sleep's a really big thing. That's one of the best ways we can recharge our batteries, and there's a talk about that coming up. The newest bit of research, which is probably the biggest change within the last few years, is how much actual physical activity actually gives us more energy than it takes away. And there's mountains of research about that, and Nikki, our physio, is going to talk about that a bit later. The other thing is general self-care and our ability to generally turn our body off and switch it off from all these thoughts and things that are going on. If we learn to look after ourselves a bit better and take some time out, our bodies are a lot more resilient to stresses and strains that come upon it. And again, there's a talk on those things coming out. So in essence, if we can get enough energy going into our battery, we will gradually build up our battery supply. If we stop then depleting it, we'll gradually find that with day on day, we'll get more energy back and enable us to do more and more activities that we're used to doing. And this concept isn't just in relation to cancer services or cancer diagnosis, it's any sort of fatigue-inducing illness you've got. The concepts are all the same. So I'd just like to end this bit by saying, do be kind to yourself. Don't put unrealistic expectations on yourself. Don't feel you have to do everything. Try and pace it and think about you don't need to. And treat yourself like you'd treat someone around you who was going through this. Just let people know that you're feeling tired and that it is a condition and that you need to give yourself some slack with that. If following all our talks you're really struggling, please do get in contact with us. We can give individual sessions, we can break down your diaries with you and start to look at how you can change things. We can, as I said, liaise with employers or do more issues. So please, our contact number's here. Please do ring and we'll see if we can see you for a one-to-one.